Welcome to MLT case study series 10. So today's case study will discuss about
elevated prothrombin time, a case study for medical lab technologists. Introduction to prothrombin time. Prothrombin time, PT, is a blood test that measures how long it takes blood to clot. It's used to evaluate the blood's ability to clot properly, which can be affected by several conditions, including liver disease, vitamin K deficiency, and the presence of blood-thinning medication like warfarin. PT is expressed in seconds and is often compared to a normal range established by the laboratory performing the test. Understanding elevated PT. An elevated PT indicates a longer than normal clotting time, suggesting that the blood is taking too long to form a clot. This can increase the risk of bleeding and may signify underlying health issues such as liver disease, vitamin K deficiency, coagulation factor deficiency, the effect of anticoagulant therapy. Case study, John Doe. Patient background. Name, John Doe. Age, 45 years. Medical history. John has been diagnosed with chronic liver disease 6 months ago. He is not on any anticoagulant therapy. Complaint. John presents to the emergency department with complaints of easy bruising and prolonged bleeding from minor cuts. Laboratory findings, prothrombin time PT, 18 seconds. Normal range, 11 to 13.5 seconds. International normalized ratio, IM 1.6. Target range for most indications, 2.0 to 3.0. But John is not on anticoagulation therapy, indicating this is elevated due to an underlying condition. Diagnosis, given John's history of liver disease and his elevated PT and INR, it's likely that his liver is not producing enough clotting factors, which is contributing to his elevated PT and INR levels. Discussion. John's elevated PT and INR levels are indicative of impaired coagulation. In the context of his chronic liver disease, this suggests a decreased synthesis of clotting factors by the liver, which is common in liver pathology. Liver disease can impair the liver's ability to produce clotting factors, most of which are synthesized in the liver, leading to an increased risk of bleeding. Management and follow-up. John's condition requires careful management to reduce his risk of bleeding while addressing the underlying liver disease. Key steps include medical management. Vitamin K supplementation could be considered to help improve clotting factor synthesis if deficiency is suspected. Monitoring. Regular monitoring of PT-INR to ensure it remains within a safe range, adjusting any treatments as necessary. Liver disease management. Addressing the underlying liver disease through lifestyle changes, medication, or other therapies as indicated by a hepatologist. Conclusion for medical lab technologists. This case study highlights the importance of PT testing in diagnosing and managing conditions that affect blood clotting. For medical lab technologists, understanding the clinical context and potential implications of an elevated PT is crucial for accurate interpretation and effective communication with the healthcare team. It underscores the role of the laboratory in the broader clinical management of patients with coagulation disorders and liver disease.
Thank you so much.